Middle Ages, you wouldn't live past 40. You'd be lucky to live into your 40s. And nowadays, we have such a little level of danger that people killing themselves is the number one thing. And therefore, it's not an uncommon problem. If there were 30 people stood in this room, 2 in their lifetime would make a genuine suicide attempt. They would take serious action, not sort of faking it, and would actually try and end their own lives. And 1 in 3 of you guys this year will have a diagnosable mental health condition.
I think in recent years, attitudes towards well-being and mental health have shifted massively, and I've noticed a massive movement around well-being, and especially with young people, perhaps because we are facing a lot of chronic diseases. People face like a lot of stress-related conditions, anxiety, depression, and especially at very young ages. So those are, I mean, this is our working population. So if people struggle in their 20s, what's going to happen? Like, you know, how their working life is going to be in the future. So definitely, I think employers are much more aware that they need to focus on well-being as, you know, a performance enhancer, but at the same time to do the right thing for their company and their teams.
If you have a disability, you go and see a doctor, you go get a letter, and you take it to your employer, and then you work together. And managers, is your responsibility to take every necessary action it would be reasonable to take to ensure that person's success at the company, so that they break the stigma cycle. But first, it has to come from you. The responsibility was not with my manager. He had no idea. It was with me to open my mouth and tell him about the realities of the situation and give them a bloody chance to be a good manager, to be a good leader, to be a good boss, a good employer. How can they be if people remain silent? I cannot explain enough how that destroys people at work, how that destroys corporate culture, and you just see heads go down, shoulders hunched, and people become a shadow of the person they were.
We need to have the leaders buy-in, really. They need to be role models. Employees won't get the benefits of well-being if they don't see the same behavior modeled in the workplace, and if they don't see their line managers also embracing well-being.